Everyone, what's up? It's Dr. Charlie here. I want to shoot a quick video after having a live session with a person who reached out to me. I recorded it. You'll see here in a minute. His name is Jake. He's calling from Arizona, and he said, "Dr. Charlie, I'm a lifeguard. I have to sit pretty much, and my butt absolutely kills me when I'm sitting." So he's got a lot of kind of glute pain when he's sitting, and he has really no other option just because of what he does than sit. So I play a little game with him. I say, "Hey, if you had to sit or you've got to sit, you've got to change your symptoms right now, what would you do? You can't stand up. You can't get out of the lifeguard stand. You can't do anything like that. Let's talk about how we can manipulate the body in many, many ways using potential movements or positional strategies, right? Such that, we can reduce symptoms or test out and see even if it's possible. So again, one of the things I do is I use movement to help people solve their problem. And if it's a movement-based problem, then we should be able to not only reproduce it with motion, but reduce it with motion. So in this case, he has a positional problem with sitting. We want to see how can this gentleman find as much comfort as possible. I think it'll be valuable for you if you find yourself, stuck sitting at work and or long car rides or something like that. You might want to check this out. Take up any information you can as I walk through a systematic process to show you how to tweak and or change or manipulate the sitting environment many, many ways such that you can find as much comfort as possible. So check it out. Let me know what you think. Be sure to hit like or subscribe in the comments below. And if you want to chat with me directly for more sort of, coaching or direct contact, go ahead and just visit www.calldrc.com. Thanks. Check it out.
So just the fact that sitting down every day is extremely painful, and a part of my job is to sit down.
Okay.
So that's just honestly the bottom line. Just sitting is just extremely painful.
Okay. What do you do for work, man?
I'm a lifeguard, so I have to sit down in a chair for hours at a time.
All right. So now let's keep going. So basically you've got, when was this car ride again? A year and a half ago?
It was May 17th of 2020.
Holy smokes, man.
Yeah, so a whole year.
You've been dealing with this not be able to sit for a whole year or something. Wow. How old are you?
22.
Yeah, that's no bueno, man. Okay. So let's talk about this real quick and then we'll go into symptoms. Basically, you need to be able to sit.
Yeah.
Pretty straightforward.
Yeah.
Anything else? So sitting is a pain in the butt, but what else? Charlie, I can't do this. Other things that don't involve sitting, you know what I mean? But like, I don't know, going to the gym, walking, running, like anything else that you're like, this thing gets worse when I do.
Well, fortunately for me, it's only sitting. So running is not a problem. Standing and walking is not a problem. It's only when I sit. So in that respect, I'm fortunate for that.
Yep. All right. So if you had to change your symptoms now, and I said, you cannot stand to do that, we're going to play a game, what would you do? You can't stand. So I take away your want to stand. You can't kneel.
Oh.
Now the game's getting harder.
I'd probably just lay down on my stomach on my bed.
Okay, you can't get out of the chair.
What would I do to make my symptoms
better?
better?
we're gonna do it right now. I don't even know if it's possible.
Yeah,
but if you had to play a game where I said, look, man, you're gonna lose everything you're gonna be fired tomorrow if you can't figure out how to change this thing when you're sitting, okay? And you can't stand, you can't get out of your chair, you can't do nothing. You've got to sit there and figure out how to take it away. What would you do? Give me some solutions.
Maybe ice pack. Maybe change the chair I'm sitting in, the way I'm sitting.
Cool. Okay, so do it right now.
Okay.
Now, yeah, so play around with it.
I usually I put my feet on the edge just to give myself a little pressure. Like I'll do one of these,
Cool.
Just to then push down on it so I can just lift my butt up a little bit. But
okay, and what does that do?
Just honestly nothing, but it's just the placebo effect, I think, that just gets me thinking that it's helping.
Okay, so if we were to say, so what you're doing right now is all you're telling me and all I'm trying to get you to do is start to run baseline experiments. Are you there, by the way?
Yep.
Cool. Run baseline experiments. And what you're saying right now is when I do this thing, we'll call it this thing, okay? Then Is it? Yep. And you've got 3 options. You've got same. This is the only possible response, we'll say, just to keep it easy. Worse, better. Oops, I don't know why my dude drew. What is this right here?
It's like the same. It
Okay,
doesn't really help.
Cool. So you would match this if this was a matching game. You would say this.
Yeah.
So now, what else would you do? I'm gonna help you in a second, but
I'll probably throw my feet up on the desk.
Cool.
Just both feet, throw them up.
Cool. So you would just say, Charlie, I'm going to do the same position, but instead of a bent knees, I'm going to do straight legs.
Yeah, and just.
Cool. Okay. Drop it in a bucket. Same, better, worse?
It's the same. It still hurts.
Okay. Cool. Okay. Pick another one. Didn't work. You're losing the game.
That's all I got in my arsenal right now, honestly.
Okay. Fair. Okay. So let's talk about this. So right now you've got 2 legs. This is a double leg position, right?
Yep.
Do 1 leg at a time. Break it down further. Do this with 1 leg, the right leg, drop it in a bucket. Do the left leg, same, better, worse. Do 1 leg straight and the 1 leg bent, same, better, worse. Do the other leg bent, the other leg straight, same, better, worse. Does that make sense?
Yeah.
Do it right now.
Okay. It's still the same for 1 leg.
Cool. And when you say same, give it a score.
It's like 40, 50.
Okay, 40, 50 baseline. It's fine. Okay, so you did the 1 leg. You doing the other leg?
Yeah, I can do the other leg.
Cool, okay.
Same thing.
Cool, all same. Cool. Okay, now do this.
As time goes on, it just gets more painful to sit.
I get it, man. Go ahead and do this. 1 leg.
Same thing.
Cool. Let it down. Other leg.
Yeah, just the same.
Cool.
Pain.
So both legs we were dropping same.
Yeah, just a gradual pain the longer I sit.
Yeah, so now it's maybe like a 52, 55.
Yeah, just as time goes on, it just gets more and more painful.
Okay, fair. All right, hang in there. Not that I want you to get more painful, but I'm pretty sure you probably do this to yourself all day.
Yeah.
So you just went forward with the body, okay, with the legs in this case, right? And you did both legs, and then you tested 1 leg, the right versus the left, legs bent, legs straight, right versus left. So here's what you did. Here was your process. Forward, and you did bent leg, forward, legs straight, forward, bent leg right, forward, bent, like coding. I'm coding you right now.
Okay.
Like left, okay, forward, straight, leg right, forward, straight, leg left. Guess where they all went?
Yeah.
Same. You picture this as a card game. You just went through all the forwards.
Right.
With the leg. Notice I said forward bent leg.
Right.
Cool. So now let's see what we got. So go ahead now. It's a little hard to bend this, but now why don't you go ahead and bend the trunk? So meaning, do this. So you're sitting there right now, okay? And you just did all these with the legs.
Right.
But do it with the trunk. Symmetrical.
It's just the same.
Okay, it's fine.
I think just the pressure just of sitting down is just what makes the pain.
I get it, man. That's what we think, but we're not sure.
True.
Okay, so go ahead now, do this. Forward, center, right. Forward, trunk bent left.
So when I go left, it'll transfer all the pain to the right, and then when I go left, it just transfers from one side to another.
Meaning you have it in both butt cheeks?
When I sit forward right now, yes. And then once I do the trunk and I go to the right, it'll transfer to the left. When I go to the left, it'll transfer to the right.
Okay, cool. So you found
it's just lifting pressure off one side.
Potentially, but do you usually have both sides when you sit?
It's a good question. So sometimes it could just be the left side, sometimes it could just be the right, and sometimes it's both.
Okay, fair. So it can be both and it can shift.
Yep.
Okay, so right now, when you say a 50, what are you saying? Are you saying the right side or the left side or both?
So right now it's both.
Okay, so it's a 50 both. Okay, got it. All right, that's useful. Okay, so now we did kind of that. How can we do it even more? Twist to the right and bend forward. Really extremo this time.
Yeah, it's just lifting pressure off.
Okay, fair. You're right. Seems like it. Now go the other way. Twist left.
Yeah, same result.
Okay. So now, it's pretty good. You twist forward, left trunk. Twist and forward, right trunk. You okay sitting there for a minute?
Yeah.
I know it's not comfortable.
Yeah, I've gotten used to the pain.
Yeah, I imagine. Twisting forward, left trunk, twisting forward, right trunk. Okay, now, just so you get my thought process, the body can go north, forward, south, backwards, east, right, we'll call it, west, left, or it can twist. Okay, so we just tested almost, for the most part, every possible forward combination. Fair?
Fair.
So we just say, basically, we just say, okay. Now, what I want to do is let's test kind of the rotary combo. We sort of did a little bit with the twist, but if you just sit there and if you just twist right and just hold it there, like all the way around, you can keep equal butt cheek pressure if you want. Does it do anything for same, better, or worse?
I think, yeah, just the same.
You think, or you're sure?
I'm sure.
Cool. Okay, go ahead, do the next one. Yep.
Yeah, it's the same.
Okay, got it. It's fine. Okay, so now go ahead and we already twisted forward. Twist. Back. Right. Do this. You might just sit a little bit closer on the front, but you're going to twist. Okay, so watch me. I'm going to twist right, and I'm going to crunch back to the right. Does that make sense? So I'm twisting and I'm crunching back right, as if you're trying to put your rib cage on your scrunch it. You know what I mean?
Yeah.
What do you got?
Same.
Cool. Do the scrunch on the other side.
Yeah, it's about the same.
Cool. About the same or the same?
The same.
Cool. Okay. Okay. So now what you're going to do is we did forward, we did back, we did the combo. Okay, cool. So now what you're going to do is you're going to just, we'll look at back. We kind of just started to ease into back. So if you just do this, if you just sit there and you go super tall, like really exaggerate the curve, you know what I mean?
Yeah.
Stay there for a moment. Okay, what do you got?
Same pain.
Cool, no change, right?
No change.
Okay, pressure seems very consistent. Okay, now you're going to go ahead and we just did back. Back right, back left. Already did that with twist. Seated. Can't really do it with the legs in this position. What if you do this? Do you have something that you can put your feet on? Or where
like
are
under
you?
me or?
Yeah, what do you have your feet on the floor or no?
Yeah, I have my feet on the floor.
Okay, if you just do this, do not lift up, but just push pressure through your right leg. Like into the ground as if you're trying to push it through the floor.
Right.
What do you got?
It feels the same.
Okay, go to the other side.
My quad's just really weak, so feels about the same.
Okay, got it. You got it. Now let's look at side. So now do this. If you do this and you just scrunch your body as if you're trying to literally keep your hand close to your body and just try to touch the floor. So I'm not saying you have to do this. See what I'm saying?
Yeah.
I'm saying just scrunch it all the way down, right versus left.
Yeah, it's just shifting the pressure.
Okay, it's pressure shift. Okay, and you do this.
Yeah, it feels about the same.
Okay. I'll call it the same, drop it in the same bucket.
Yep. See, now as time goes on, so earlier in this call I was a 40, and right now I'm at like a 70.
Okay, just builds and builds and builds.
Mm-hmm.
When would you get up? Now?
I probably wouldn't have even sat down to begin with, just because I don't have work. So I try to stand as much as possible. I try to avoid sitting as much as possible.
When you get to work, when you do get to work, you have to sit. So what do? You it builds to an 80, and then you're like, somebody needs to be rescued in the pool, or what happens?
I'm just sitting there in pain until I get rotated out.
Ah, got it. That's not cool. All right, I'll let you rotate out in a minute. All right. Okay. So now, if you put pressure, if you put your hands here and you push into them, push hard, push hard, push hard, push hard, push hard, push hard, push hard.
Same.
If you cross this leg up, I know you've done this before, I'm sure.
Yeah. Yeah, it just shifts the pressure over to the opposite leg.
This is rotation. We'll call it the legs or the hips. Okay, now go to the other one. Yep.
Yeah, just shifting pressure.
Okay, so it can. Now, have you ever tried shifting pressure such that it gets symptoms from a 70 down to a 20 in one of them, and then you can offload it back and forth?
Yeah.
Okay, got it. Does it work or does it not?
It works for the most part.
Okay, got it. All right. So we got left figure 4 rotation, right figure 4. We already tested. Doesn't matter if you do this. I know this is really funky, but it doesn't matter if you sit like this. Can you do it?
I haven't tried that one. Let me try that one.
Really weird rotation, but I imagine.
Yeah, it just lifts up the pressure on the whatever leg you're bending like that.
Okay, fair. So it's all test the other one for me.
That does work. Puts a lot of strain on the knee though.
Yeah, fair.
Yeah, it just lifts up that one butt cheek, so it doesn't really hurt as bad.
Yep, guys, we'll call it hip internal rotation. It's called. Okay, you can't accomplish the same if you just do this. If you just hold it there with your muscles, right? I know it's weird, but I'm just wondering. Or if you W sit, you ever see some people sit like that versus like that? It doesn't work.
No.
Okay, got it. Cool. Okay, so we got that, we got that, we got that, we got that. So forward is in the red. A little bit of twist down the bottom. Rotary is kind of here, a little bit of rotary here, as well as back. Forward, back, and then obviously we broke it into left and rights. Yeah, you are right. You cannot change it with motion. Miss anything else? Forward, back, forward, back. Any other pain or problems? Back pain? Anything like that?
No.
Just straighten the butt off. Okay. So now you've tested already sitting on probably some type of like donut, anything like that.
I have not. I've been looking into that recently though.
Yeah, you're gonna want to for sure. Anything else? So for example, if you sit on like 3 pillows right now, does it matter?
It does not matter, but what I've been trying to do is like folding a pillow and putting them under my thighs. That way my butt doesn't really touch the seat.
Yeah. Go get a pillow right now and sit, dude, like I'm talking like this here. Sit like, it's really weird, but sit center like this.
Just on top of it?
Yeah.
Like a saddle?
Yeah, saddle chair, we'll call it. I don't know if it'll matter or not, but let's just test it.
I haven't tried that one yet.
Some funky stuff.
Yeah, as of right now, since I got up and alleviated some of the pressure, it doesn't feel too bad.
Okay, what does your gut tell you? Listen to that.
That it's going to get worse as time goes on.
It'll just get worse.
Yeah.
Okay. Yeah, you've tested pressure on the buttocks with a tennis ball, with foam rollers, all that.
Yeah.
Okay, no better. Worse? Same, better, worse?
It's just when I do the tennis ball, it just feels like I'm just like getting a deep massage in the area.
Okay, it doesn't make it better or worse?
It just feels like a massage.
Yep, got it. Okay. All right, anything else? Stiffness in your mid-back? Any other funkiness?
No.
Literally just pressure?
Just, yeah.
Okay. Yeah, I mean, you're definitely going to want to consider some donut of some sort, probably, to test it.
Right.
Or I was thinking even like a inner tube, like you work at a pool. Do they have any type of like, I don't know, something that kids go in, you know what I mean? Whatever.
Yeah, that's a really good idea.
Yeah, that's where I would go. So, and that might, look, I'm not saying it's permanent. I'm just saying here's what I'm saying.
That's my biggest issue.
It's your biggest issue. You have no chance of solving this probably if your job requires that you sit in yuckiness for like all day and on and off. It's just like, 40, 70 guy, I'm just pushing through it. And then, you get a little shift break. And it's like a 40, 70. Oh my God. If you're just lighting the fire all day, I mean, look, I'm sort of like Mr. Motion where it's like, we can use motion to try to solve this. That's what I do. Right. But if it's not motion, trying to apply motion in the presence of a really yucky environment, the chance of it working is very low.
Right.
Because if this is water and I've got I've got this much water, okay? And then I've got this much gasoline, it's like, well, good luck. I mean,
yeah,
good luck putting out the fire, right? So the first step in solving this, man, is going to be for you shifting pain triggers. And I mean, all of this stuff leads to it no better, which tells me that motion can't change it in the moment. As far as when you're sitting there, if you had to play the game, if this was the board game and I said you can't stand, this is how you would think about it. You'd have a come up with a system. The body can go forward, go backwards, it can go left, it can go right, it can go bent knee, it can go straight knee, it can go bent torso, but like whatever, you can rotate. Cool. And you would literally test all of these things, and I did, and it's not changeable.
Right.
Okay. It's only changeable because you say, well, I think this one does a little bit because I'm lifting pressure. It's pressure related.
Right.
All right. Now, what kind of car do you have?
2000 Toyota 4Runner.
Okay, cool. So when you were in the car, is that what you were driving?
The first trip we took, I drove my car. And the second trip we took, we drove like a brand new Volkswagen, and the seats were like super, super hard.
Yeah. The first trip, did you have the problem, or the second trip?
The first trip I had the problem. So when I got back, I was in pain from sitting, like any pressure hurt, but it just went away on its own. Thank God. And then the second trip, I was expecting that to happen again, to have the pain just go away on its own. But a year and a month later, we're still here.
Yeah, it's not working. Okay. What else have you had? You can see me, by the way, still, right?
Yep.
What else have you had as far as imaging, treatment, injections, exercise, any of that?
I got X-rays, and I got I think it's meloxicam.
Naloxone, it's an NSAID, anti-inflammatory.
Anti-inflammatory, right? Yeah, and I got X-rays, and they found like a hip discrepancy.
Okay.
So I guess my hips are not completely straight.
Yeah, that's not gonna matter.
Yeah, that's what I've been telling everyone.
It doesn't matter. It doesn't make any logical sense because let's just say that I don't know. Oh, the one leg's longer than the other. Well,
That's what I've been saying.
yeah, because you have it on both sides.
Exactly.
And it hurts the hell when your legs aren't even in play. It hurts. Your legs aren't longer when you're sitting. Your legs only longer if you got a little bit more length. It only matters when you stand. So you should only have symptoms then if that's the
exactly.
right. So,
that's what I've been trying to explain to my parents and everybody else.
Yeah, it's a bad hypothesis. I'm not saying
they're saying like genetics is just like this. Their reasoning is that it's coming from the leg hip discrepancy, but before this car trip, I had no pain whatsoever.
Yeah,
it only happened after the car ride.
Your logic is much better than theirs. Okay. Okay. So, all right. So leg length. So, but they didn't see anything funky. They didn't see any signs of ankylosing spondylitis, funky stuff, or whatever. Look, it doesn't sound like that, but I'm just curious about. They didn't do any blood tests, anything like that.
No.
Okay. No genetic testing.
No.
Cool. No symptoms otherwise. Cool. You have good motion for the most part, as far as your ability to touch your toes, like bend, like do all that?
I'm not too flexible.
That's okay. Stand up and let me see you bend backwards, please.
Bend backwards or?
Yeah, buddy.
It's like this way?
Yep. You got enough motion. Touch your toes?
I can't touch my toes, but I can get close. It's about as far as I can get.
Okay, got it. Okay. Take a, well, you can stand if you want, man. It's up to you, buddy.
I can take a seat.
Okay, so let's talk about this. So what else then? So professionally, that's kind of what happened. Any chiro, any PT, any massage, anything like that?
I haven't done any of those, but I'm planning to get into a chiropractor next week.
Okay, got it. All right, so okay, so personally, what have you tried? I'm sure you looked something up on YouTube. That's how you found me.
Stretching, tennis ball, and ice, and then personally, I just tried to. I had a week off of work about a month ago, so I just tried to not sit the entire week, which honestly was just mentally exhausting.
Oh, I'm sure.
Not sitting down.
Okay, so then what happened a whole week? Did you recover or
no? For the most part, not really.
Okay. Sensitized. You can't bring on the symptoms doing anything else besides seated.
It's just when I'm sitting.
How do you get to work? You just drive or you walk there?
I drive.
Okay, and driving is just as painful? What's the worst way to, so when you're sitting, you're probably sitting on something like a stand, a guard stand or something?
Yeah, it's just a hard wooden chair.
Yeah, that's no good. I'm guessing, maybe I'm wrong, is hard better than soft or no?
It's actually a good question because right now I'm sitting on a super like comfy office chair, but this one seems to give me the most pain quicker compared to my car seat or even the seat at work, which is weird to think about.
Yeah, because then it goes against your pressure.
You'd think harder would be more painful.
Yes, you would. I've seen somebody like this for. Okay, so now anything else, like as far as like going to the bathroom or any burning with urination, anything else funky?
Nothing.
So you would say everything else for a 22 or 23-year-old, however old you are, everything else is normal?
Yeah.
No back pains? Never threw your back out doing anything?
I've had back pain recently, or not recently, but in the past. It's just normal, like just from being on my phone or playing video games too long or lifting with my back instead of my legs. Just normal back pain. Okay, got it. All right. Do you have anything right now sitting there? Your feet are on the ground? Yep. Okay. Do you have legs on your chair? No, I'm just sitting normally. Okay, fair. But do you have legs on the chair? Meaning, I got legs in the chair. Thanks, bro. Okay, like one leg or two legs? Like it's the like the one that rotates, I guess, if you will. So you got one central pole with a rotating leg. Right.
Okay, no problem. All right, so what I want you to do is take that. Here, I'll show you on mine. You got something like this.
Exactly. Yep.
Okay, so what you're going to do is you're going to take the right heel, okay, try to like get the thing forward a little bit, and just on the front of it, okay, take the right heel and try to contract into it. So like it's right here, you're just going to shoot, let me get it centered. Ugh. Okay, right there. Okay, you're going to try to just dig your heel and contract like you're trying to like you're working your hamstring a lot when you do it, but just do it for a second.
Just push down on it.
Not push down, curl into it like you're trying to like push.
Oh, I see.
Push back.
Right.
Do it for a moment.
I can feel like it's working my muscle right here.
Yeah,
or my hamstring.
Does it reproduce your buttock pain?
It does. On the left side, because I'm using my left leg.
Go to your other side.
Yeah, it goes away. But how long can I hold this position for? That's my question.
Yeah, so you don't.
Yeah.
It's not the point of it. Go to the left again. What happens to it?
I just, instead of focusing on the pain, I can just focus on like my hamstring curling.
Okay, fair.
Yeah.
Go to the other side.
I mean, yeah, it helps me forget about the pain.
Okay, so distinguish that. Does the motion itself take away the baseline pain or no? Override the work and ask yourself, what is happening to the burn? I know I'm feeling it, but what happens to the burn?
Kind of gets pushed away, or not pushed away, but it kind of gets less intense, I guess.
Okay, so you would say, for example, it starts at blank and it goes to blank, and that's lower?
Well, to say, for example, it starts at 50 before I do the heel thing on the chair, and then it goes to like a 30.
Okay, so do 5 right now. On the left leg, which is the worst butt cheek right now? They're both the same.
They're the same.
Cool. Go do 5 right now. 5 45-second holds.
5 40-second?
I'll time you.
Okay.
Yep. Now look, if you feel like, oh my God, I'm only at 15 seconds, I'm not going to make it. Do a little bit less. You got 30 seconds left.
Yeah, so the pain just shifts to my hams. Not the pain, but since my hamstring's working, it's more easy to focus on that than it is the pain. But for the most part, the pain has kind of dwindled a little bit.
Keep holding. Relax. Go do it again.
Left side?
Same side. It's fine. Break. Go again.
It's kind of hard to tell if it's working or not.
Okay. Keep going for a minute, okay? I know your hamstring's burning a little bit.
I'm going to switch to my right side.
It's fine, man. Break. Now, what do you got on the left side right now? Give it your number. Same or worse. Any answer is fine.
20. It's not like a burning pain, but you can definitely tell there's some discomfort. I mean, it seems to be working.
A little bit. It's doing is better than anything else you've done.
Yeah, definitely better than anything I've tried while sitting down.
Yeah, and look, I'm not saying the problem is the only reason I forced you in the game to stay seated is because that's job.
Yeah.
That's lifeguard. So it's like, yeah, cool. I could just get down. Well, you're probably not going to work too long if you just like get up and walk away.
Yeah, I mean, I could stand just right next to the chair.
Yeah.
I'll probably just start doing that.
Yeah, fair. Okay, got it. So yeah, you can chill. All right, just relax for a second. Okay. Okay. So you get the concept. Okay. Yeah. So we just played a game. Get rid of your butt pain, and you can't get off the chair. All right. And you didn't really win, but you found some interesting things. Okay. You combined a lot of stuff. Okay. Body can go forward, backward, left, right. I can do it with bent legs, straight legs. I can do it from below with my legs. I can do it from above with my trunk. I can, all these different ways. Cool.